Hello friends, welcome to my page Managing Diabetics. Alright, on this video, as I promised earlier on, I'm going to be discussing symptoms related to frequent urination. For the past couple of 2 weeks now, we've been discussing about frequent urination. One thing you have to understand is that frequent urination is one symptom of diabetics. So if you have hyperglycemia, or sometimes when you have hypoglycemia, you might be experiencing frequent urination. And that occurs when your sugar level elevation is too high, above the target range, you're going to experience the urge to be urinating frequently. And why you are urinating frequently is that because your kidneys are overworking over time. So your kidney are now overworking over time to get rid of those excess glucose levels floating in your bloodstreams, out of your system, okay? And then at the same time, when you are getting rid of those excess glucose levels, you're also losing fluid. And because you're losing fluid, dehydration is going to kick in and you're going to be drinking a lot of water. So that is why frequent urination is a symptom of diabetics. So when you experience this symptom that you are urinating more than required, there are other possibilities. You might not even be diabetic. Okay? You might not even be diabetic. So there are other possibilities that you are not diabetic. You go for a blood work and your sugar level is normal. So they are going to look into other areas why you are peeing a lot. It could be overreactive bladder, which is OAB, or it could be any kind of bladder infection, UTI. So the doctors are going to look into all those things to figure out why you are urinating. I've come across patients that are urinating frequently, and when we conduct a blood work, they are not diabetics. So there are other risk factors that may be associated while you are frequent urinations. Now, we're going to look into symptoms why you urinate a lot. And those symptoms can be divided into 3 categories. Say, for instance, if your frequent urination is as a result of OAB, overreactive bladder, then the symptoms is going to be different when your frequent urination is due to UTI. So we're going to look into these critical areas. Why are you urinating a lot? So what is considered a normal urinary frequency can vary from person to person. Okay? So I might be urinating a lot and you're urinating a lot. So what I might consider to be too much might not be considered to you to be too much. So that's what I'm trying to explain. So some people naturally need to go more or less often than others. Okay? But as I advise to all my students, all of my patients, all my fans, is that self-medication can only last for 7 days. After 7 days, you still experience those symptoms, stop that self-medication and then consult your doctor to run a blood work on you to find out why you are peeing a lot. All right? That could save your life. So, expert doctors have considered urinating at least 8 times a day to be a frequent urination. We normally consider 4, if you want to push it, 5, to be considered normal urination 4 or 5 times a day. But when it extends to up to 8, then that is going to be considered as a frequent urination. That means you are peeing a lot. So as I said, any other symptom you have will depend on the cause of your frequent urinations. And as I said to all my fans, doctors don't treat symptoms. They treat the underlying cause of those symptoms. So when we treat the underlying cause of those symptoms, we are going to get rid of those symptoms. When you treat symptoms and leave the underlying cause, that symptom is going to return back again because you've not dealt with the root cause. So doctors treat the root cause of that symptom to get rid of those symptoms. Okay, so that is why the root cause of your symptoms is very important to doctors when you go to them for help. So now, say for instance, you have OAB, overreactive bladder. What are the symptoms of OAB, overreactive bladder? So as I said, frequent urination are categorized into 3 possibilities. Either you are a diabetic, overreactive bladder, or UTI. So we're going to look at the symptoms of these particular 3 areas while you are frequent urinating. Some symptoms might be similar, some symptoms might not be similar. But it is important to look at each and every way to make sure we don't miss anything and overrule certain things and then tackle the overall cause of the possibility that this is the reason why you are urinating. So as a diabetic, I always advise all of you to make sure you handle your sugar level at all times. Controlling your sugar level at all times is going to save you a lot of complications and a lot of headache. It is when you don't control your sugar level, you are allowed to generate to an extent whereby it has caused a lot of damages to your kidney and liver, then you're inviting more complications and trouble to your life. Okay, so we're going to look at the symptoms of OAB. For instance, if the cause of your frequent urination is as a result of overreactive bladder, what are the symptoms? Okay, so we have what we call urinary urgency. We have what we call urinary urgency. And what it means that the inability to postpone the need to urinate. That's what we call urinary urgency. Or in other words, the inability to postpone the need to urinate. So you are under pressure. You want to urine. You could feel the pressure is mounting, is building up. And you try as much as you can to postpone it, to hold it. But it cannot. The more you try to postpone it, the more the urge build up. So that is what we call urinary urgency, or the inability to postpone to urinate is one of the symptoms of OAB, which is overreactive bladder. Okay, so now the second symptoms of OAB, overreactive bladder, is something we call leaking urine or urinary inconsistency. When you have inconsistency in your urine, or we call, your urine is not consistent, you could see that you are urinating every second or every minute. We could term that as leaking urine or urinary inconsistency. That means you don't have your urine on a particular day or a particular given time is not consistent. Okay, all of a sudden things change. You are not the type that urinate up to 4, 5 times, 6 times in a day, but all of a sudden you are doing 7, 8 within a space of how many, 2, 3 minutes or an hour. Okay, then that becomes an inconsistent, or we call it leaking urine. This is one critical example of overreactive bladder. Okay, now we have something we call nocturial. Nocturial, I've told you guys. Okay, nocturial, okay, is when you are waking up multiple times a night to urinate. Okay, nocturial, or when you are waking up multiple times to urinate, is what is called nocturial, and it's one symptoms of overreactive bladder. So that is one symptoms of overreactive bladder. So why I tackle it this way is that, for instance, if after conducting all series of tests, I will say, for instance, you are my patient, I'm your doctor, and then I have run series of tests. I've checked your blood sugar level, this is normal. I've checked for UTI to see if you have any kidney infections or UTI infections. I could not find any infections. Then I said, okay, let me try one more. And I find out that you have overreactive bladder. So at least we'll be able to find out why you are urinating a lot, that it's overreactive bladder. Then that is the symptom. Okay? That is the symptoms of overreactive bladder that I just explained to you guys. So when we go to the symptoms of UTI, it might be similar or differ from overreactive bladder. But it is important to understand what are the symptoms of overreactive bladder and why you urinate. So let's go to the second aspect of it, UTI. Say, for instance, again, let me just give you just an example, okay? You are my patient, I'm your doctor, and I've ruled out that it's not overreactive bladder that makes you to urinate, and I rule out that it's not diabetes, your sugar level is normal. But when I do a UTI test, I find there is an infection in your tract, or your kidney is infected. Remember, the process of your kidney, the process of your urine, the urine production start from your kidney. So that is why from your kidney to the penile or vaginal area are your tract. So we'll find out that you have an infection in one of those tracts. Then at least we'll be able to notice that, yes, the cause of your frequent or inconsistency in your urine is as a result of UTI infection. Okay, and we know UTI infection is as a result of bacteria. Okay, so once we're able to notice that, then what are the symptoms of you having UTI infection? What are the symptoms? We're going to look at those symptoms again. All right. Now, one symptoms, as I said, they might be similar or different from overreactive bladder. So one of the symptoms that is more similar to overreactive bladder is the inconsistency or leaking urine. Okay, you have an inconsistency in the pattern or how often you urine. All of a sudden, from 1, 2, 3, 4 in a day to about 7, 8, 9 in a day. So that becomes an inconsistency, a headache for you. That gives you a concern that to visit your doctor to find out why you have this inconsistency in your urine. Okay, so those are one of the symptoms. Now you have pain or burning sensation during your urine. Sometimes you are urinating and you are feeling pain in your penile or vaginal area, or it accompanies with a burning sensation in your urine. There could be a sign of an infection. Bacteria in your urethra that have gained entrance into the urethra, to your bladder, and then to your tract of your urine. So when you have that pain or burning sensation during urination, that's one of the symptoms of UTI. You have an infection in your bladder. Okay? And then the third one is when you have a strong smelling urine. There are some people, when they go into the bathroom, as soon as they come out, they didn't poo, they just urinate. But the stench of the smell from the urine indicate that they have a UTI infection. So the strong smell from your urine is an indicator that you have an infection in your bladder. And you have to find out what infection to start treatment. So strong smelling urine could be a symptom of UTI. Now, the next one is blood in the urine. I've been peculiar in this blood in the urine, okay? I've been peculiar in this blood in the urine. Hold on, I'm trying to figure out... Okay, so blood in the urine is one symptom of UTI. And I've been peculiar. I've been advising you guys about why you should be concerned when you have blood in the urine. And even in the video that I did earlier today, I did mention it. Now, there shouldn't be any trace of blood in your urine at any time. And this is called there shouldn't be any trace. Now, there are some blood that you cannot see with your naked eye, but under microscope you can see it. And that is why I've advised, anytime you are peeing, watch your urine. Do not there are some people who have this habit of when they are urinating, their eye is somewhere, and they don't even want to look at what their urine looks like. It's a bad habit. By monitoring the urine, looking at it is part of monitoring your health. So, when you notice that your urine, you can see a naked blood in your urine, is a serious health condition that you have to go and see your doctor immediately. Now, why can you see blood in your urine with your naked eye? It means it has gone to an advanced stage. There are some minor symptoms you've been ignoring, and then it has advanced. The time you start seeing blood with your naked eye, when it has gone to an advanced stage. They start peeing and see blood. But in the earlier stage, you cannot see blood in the urine except under microscope. So sometimes when you go for a blood work and then the result comes out and doctor tell you, I could see a trace of blood in your urine, you are going to be confused because you are urinating every day and you couldn't see the blood. But that is under microscope. So you can see it under microscope or with your naked eye. There are two scenarios, either under microscope or under with your naked eye. There shouldn't be any circumstances you see protein or blood in your urine. Now, when you see blood in your urine, that's what we call hematuria. When you see blood, the medical term for it, when you see blood in your urine, you call it hematuria. And hematuria could be as a result of kidney disease, okay? Could be as a result of kidney disease or an infection or a rare blood disorder, okay? That is causing, you will call it, medical term is called hematuria. Now, it could also be a sign of tumor or cancerous, either malignant or benign. That is why it is important when you see blood in your urine to see your doctor immediately. The earlier, the better. All right, so I'm not going to deviate from this. It's a different topic entirely if I want to discuss about hematuria and why do you see blood in your urine. It could be as a result of infection, kidney disease, or rare blood cells, or any tumor in your prostate or in your bladder or any part of your body that need to be checked out. All right, so that's one symptoms of UTI. Now, the next one is what we call lower blood abdomen. We are discussing about symptoms of UTI. The next one is lower abdominal pain. When you have pains in your lower abdominal here, below the belly here, before your penile or your vaginal, that is the lower abdominal. When you start feeling pain in there, could be as a result of UTI. There's an infection somewhere in your tract. Now we have fever, chills as also a symptom. Fever or chills. These are all symptoms of UTI, and at the same time nausea. These are all symptoms of UTI. Okay, so these are the conditions or the symptoms of urinary tract infection, UTI, and the one I just mentioned before is overreactive bladder, the symptoms. So there could be a similarity or different symptoms, but it is important to understand all these symptoms. So when you start going through them or you start feeling them, try to consult your doctor to know what is going on with you. All right, so now if you have a different condition apart from this, okay, if we rule out diabetics, rule out UTI, rule out overreactive bladder, there could be other condition that is causing you to have pee a lot. So conditions that affect the bladder or the prostate can also lead to other urinary symptoms. All right, such as, you have the painful urination or blood in the urine, pelvic floor dysfunctions, and again can cause you painful urination. There's something I want to throw in here about pelvic floor dysfunction. Your pelvic area, this applies to both men and female. Your pelvic area is an important organ of your sexual health. If anything injures your pelvic area or damages it, it's going to affect your sexual areas, because your pelvic controls anything about your sexual area in terms of your erections, libido, and whatever. Both in men and women, there are muscles around those areas that controls your sexual functions and healthful sexual health. So that is why you have to take care of your pelvic area to make sure that nothing injures or damages that area. Okay, so if those muscles in those areas are weak, okay, not contracting properly, blood cannot flow in those areas. You can't get an erection because your pelvic muscles are weak. So that's why sometimes you have to be exercising to keep those areas, very strong and agile, so that blood can flow in those areas and then give you that erection that you need for your sexual life. This applies both to female and then male. Now, so that is in those two critical areas. So I'm going to, in this video, I'm going to just leave it those areas and those symptoms, so that I don't want to make those videos to be too long, but I did promise I'm going to discuss the symptoms. Now, on my next video, I'm going to discuss about diagnosis and testing. Okay, I'm going to discuss about diagnosing and testing on my next video, and in the next subsequent video, I'm going to discuss about how to stop frequent urination. So I want us to discuss, make sure I complete this particular topic in this several videos I'm going to do, and then move to another topic. But why it is important we are discussing frequent urination, because it's a symptoms of diabetics. But we don't want to just be peculiar to diabetics. There could be other reasons why you pee a lot. And that's why I'm looking in those areas for you to understand that you might not be diabetic and be peeing a lot, or you're diabetic and be peeing a lot. But there are other factors that might be contributing why you pee. So friends, I'm going to leave you guys here to enjoy this video. If this is your first time coming across my page, give me a thumbs up and give this video a thumbs up. And also subscribe to my page. If you have not yet subscribed to my page, press the subscribe button. It costs you nothing to follow me on my page, all right, as we grow. So I'm going to leave you guys here. I'll read your questions and comment later. Send in your questions, send in your comments. And for those that have been following me for the past how many years, I give you thanks here. All right. So I'll see you guys in my next video on the diagnosis and testing. All right. Stay blessed. Bye-bye.